The Honourable Minister has engaged himself with a lot of stakeholders. It's with a great pleasure to introduce the chief guest.
One of the things that I want to say to you today, the fact that I'm here is a statement that government values you as nurses. Do you understand? Government values you. When the Minister for Health says yes to come and be part of the occasion, it is a statement from government saying that we value nurses. Do you understand that? We value nurses. So I've heard everything that's been said by the President, but I want to start with that statement. If we didn't value you, I wouldn't be here today. The fact that we value you, I am here. And I'm here to listen, and my Chief Nursing Officer is going to be with you for the next few days to listen to you. Because we value you. Because you're important. You're the backbone of health in this nation. And so I congratulate you for having your 62nd AGM and the opportunity for CPD. And I was at the WHO meeting, the executive board meeting, and in the executive board there's only about 33 or 34 nations of the world. Fiji had a chair for 3 years. The last meeting that Fiji was part of was in February, so I went. I went to the meeting, and in that meeting, the Director General said, next year will be 200 years since Florence Nightingale was born. And we agreed, and I put my hand up and said, I fully support that 2020 is a year of a nurse. So I hope you're feeling a lot better now, because it was probably a little bit doom and gloom. But it's not doom and gloom. We value you. And I put up my hand on behalf of our government and said that we support 2020 as a year of our nurse. And I've already talked to the Chief Nursing Officer about how we can be able to celebrate it right around the country. There's 12 months next year. There's 52 weeks next year. There's 365 days. So how can we ensure that we penetrate our country with the message that nurses are important? Because we need to continue to bring your younger sisters, your daughters, your sons, your brothers into this noble profession. And it is important not only in terms of the work that they do, but also in terms of protecting the health of our nation. The theme this year is Nurses, a Voice to Lead and Health for All. And that's very relevant to the role of nurses in Fiji. As a government, we believe in equality, and as a government, we believe that we will leave no Fijian behind. And it doesn't matter whether Fijian is in Onilau, or in Moala, or in the highlands of Nabosa or Naitasiri, we will leave no one behind. We will also make sure that our people, the nurses, and the doctors, and the health inspectors, and the dentists that are working in these areas, they will continue to receive the support that they should need to be able to provide that level of expertise and also do universal health coverage as we've been talking about. I worked as a surgeon as a consultant for maybe 12 or 13 years, and as a registrar for another 8 years or so. I've learned a lot from the surgeons. I've learned much more from the nurses. And as I stand here today, I see a lot of familiar faces. I've learned from the nurses, the old sisters, how to talk. So if I say something wrong, you blame them. They taught me how to talk. Because the old Mr. Itika, he didn't talk a lot. Professor McCaig, whenever he talked, he was telling us off. So my communication skills I learned from the nurses in theater, in tea room, in the ward. So as I said earlier, if I say something wrong today, please blame these ladies in front here. And we also had we had nicknames. So Matron Sister Varanisese Nakete, she was Professor McCaig's favorite scrub nurse. She was so good, she was called Boy. And I still call her Boy. And Matron Ranandi, Director Don Matron Ranandi, I kept on getting confused. Sometimes I call her Queenie. Ranandi Queenie. So we all had nicknames. And we had awesome time working together. And some of the best times that I've ever remembered was in the middle of the night and going down to buy bread because we were going through cases. And some of those opportunities for working together, I then realized it didn't begin there. It actually began when we were students. And one of the things that I am really pleased with the Fiji National University is the fact that we are able to bring, in the College of Medicine, Nursing and Allied Health Sciences, bring these professions together so that they interact on a regular basis. Maybe not as much as we did back in our days, but interact on a regular basis. Share teaching material. Share teachers. Because in our line of work, we work together. No man is an island. Because we are codependent and interwoven. You're all leaders wherever you are. Wherever you are, you're a leader. One thing that really inspires me when I tour throughout the nation, we have 207 facilities. And I'm aiming to finish all 207 facilities before next year. And as I tour throughout the nation, one of the things that inspires me is when I go into some of these areas and I go and I visit Bisongo Nursing Station and I go to Tawake and I go up to Nanrao Nursing Station and I see our young nurses, being the backbone of our service. And they're standing there and I look at them and I look at their government quarters. Some of them have nice government quarters, some of them obviously they're in the pipeline to be repaired. And I see the stamina that they have and the perseverance. It inspires me because I then realize that I got to be at my best. That I have to be at my best. And that's one thing that I'm driving in Denham House at the moment, is the mere fact that we exist because you exist. The reason why we exist in Denham House is because you exist. And the reason why you exist is because of the people of Fiji that we serve. And so we exist to serve you. That is our role. We exist to ensure that you are equipped, you are resourced to be able to do the job that you are called upon. So I ask us to be proactive, to think critically, and Dr. Andy Alisi would know this. These are some of the graduate outcomes at the FNU, being a critical thinker, being an effective communicator, being responsive, being mentally strong. And there are changes that are happening. One thing is for certain, that the expectations of the Fiji public is completely different from what it was 20 years ago. Completely different. And we have to move with that change. And so the challenges that we face today, and I've heard many people say to me, and they say, oh, I face many more challenges in this work environment today. And then I realized back in the days, 30, 40 years ago, there was only a few of them. They didn't have all the fancy machines that we have. And so what brings to my mind is that challenges of 30, 40 years ago may be similar in capacity to the challenges we face now. And many times as a consultant, I look at my registers and my interns and I say, you guys are not working hard enough. But back in the day, they didn't have to explain long enough. They didn't have to talk to every family member that came, because that is the expectations of today's public. And so I want to challenge us today with the mere fact that the challenges are more, but they may be relatively same. I'm told that you have CPD beginning from tomorrow as the AGM begins, and I'm very, very, very supportive of continued professional development for all our staff, especially in this regard to nurses, and we've set aside a considerable amount of money for nurses CPD. On Tuesday morning, I came into the office. I had a relatively busy weekend, and I opened my email, and I saw, and Chief Nurse sent me an email just saying, Juliet Rika passed away. And I was thinking up and down, I had things to do. And then by 12 o'clock, I said to my executive support unit, I said, bugger all. Cancel everything in the afternoon, we're going down to Laucala. So we went down to Laucala at 4 o'clock on Tuesday afternoon. At about 7 o'clock, we went into the house, we sang hymns, we met their family, talked to the children, hugged them, and then I called the doctors and I said, we need to go and talk. So we went, we sat down around a bowl of grog, and I was talking to the doctors about the importance of supporting the nurses, about the importance of looking around them. Many times, we are all busy, and we are looking at the patient, and we're looking upwards at God, and we're not even looking beside us. And what we need to do is we need to be looking around us. We need to be supporting the nurse beside us, the young doctor beside you, the cleaner who's cleaning your facility, because you don't know what they're going through. And I think today, yes, one of the things I want to leave with you today is the importance of supporting one another. Because you may have so many challenges on your plate, but the person beside you may have even 3 times more than what you have. So I congratulate you once again. I want to reiterate that we support nurses in this nation, despite whatever you hear and whatever people say. Even if nurses who are here say that government doesn't support you, I want to say today, my being here is telling you that you are supported. If you see on Facebook some nurse from overseas saying that you're not being supported, I want you to tell them today that you are supported. Thank you very much.